Hello everyone, it's me Dr. Ayaz Ahmed, working as the aesthetic dermatologist. So today I will discuss another important topic of dermatology. The name of topic is melanoma. Hopefully you will learn and subscribe my YouTube channel. So melanoma, it is actually a malignant cell tumor of melanocytes. Melanocytes are the cells present in our skin that produces pigment for different color. The tumor of these cells results in melanoma. This picture describes single mole-like structure. This single mole-like structure suddenly increase in size within a few months. This picture also describes irregular border. These irregular border with different color and suddenly increase in size within few months suggest any malignant growth or melanoma formation here in this case. So by definition, it's a malignant tumor arise from melanocytes. How to detect melanoma in earlier period? So there are some findings which differentiate normal lesion from malignant lesion. For example, this lesion is the normal. This first row describes normal characteristics of lesion and second row describes malignant change. There are four parameters. Number first is the symmetry, second is the border, third is the color, and fourth is the diameter. Now when the symmetry of lesion, for example here in this case this is symmetrical lesion. When there is malignant change, the symmetry of lesion changes. You can see here is symmetrical, here is the asymmetrical lesion. This asymmetrical lesion suggests malignant change or melanoma formation. In second picture, first look at the border. This is uneven. This is even border. Whenever there is a malignancy or malignant change, the border changes and it become uneven border. Third is the color. Here is a single color and here is the multiple color. And fourth is the diameter. Here lesion is smaller than 1/4 and here lesion is greater than 1/4. So these are the changes which are noted in early lesion. Epidemiology, incidence and mortality. Melanoma accounts for 4% skin cancer and 80% skin cancer death. It's a common in sunny areas and white population. The global incidence is 1,60,000 new cases per year. Higher incidence is in Australia and New Zealand. In Australia and New Zealand, cases are very high. This may be due to sunny weather over there. The melanoma is diagnosed at any stage except very early age. 0.6% cases of melanoma are usually diagnosed under 20 years of age. Median age for the diagnosis in US is about 60 years and 7% at 85 years of age. The pathophysiology and predisposing factors. 75 to 80% of cases of melanoma arise from normal skin. 20 to 25% of cases of melanoma arise from melanocytic nevus. Congenital nevi, especially large congenital melanocytic nevi greater than 20 centimeter. It is estimated that there is 5 to 15% risk of having melanoma, but it's probably lower than 2.5 to 2.8 percentage. Melanoma associated with large congenital melanocytic nevus are located mostly on the trunk. Presentation is a satellite and diameter larger than 40 centimeter. This picture describes congenital melanocytic nevus. You can see this large lesion on the back of trunk in first and in second picture. You can also note there is a different color variation in this nevus as I already discussed. These color variation are multiple color with irregular border. These are the actually malignant changes. Larger melanocytic nevi usually located on trunk area. Common and atypical or dysplastic nevus. These are actually the type of nevus. Common nevi transformation into melanoma is very low. Atypical or dysplastic nevus are acquired pigmented lesion either by the pathological or clinical features. A typical nevus represents only 5% of reports of melanoma, while dysplastic nevus represents greater than 5 mm with irregular distributed color with tendency to emerge after young age. These features suggest excision for fear of melanoma. Genetic, skin pigmentation and tanning abilities and nevus phenotypes. Genetic is also involved, especially when family history is positive. For example, familial melanoma. Skin pigmentation and tanning abilities reflect skin sensitivity to sunlight and risk factor for melanoma formation. Risk is about twofold more in skin type 1 is compared to skin type 4 and white against black. Risk is 1.5 percentage 1.5 fold more than blue colored eyes than black colored eyes, and it is 3.5 fold more than red hair people versus black hair people. Nevus phenotype depend upon genetic background and sun exposure. It ranges from no nevus to 10 to 30 nevus or larger than 30 nevus as seen in dysplastic nevus syndrome. This picture describes dysplastic nevus syndrome. You can see there are lots of small nevus on the back of trunk. This is the dysplastic nevus syndrome. Almost it involves whole of the trunk area. Associated gene. So number first and most common gene is cyclin dependent kinase inhibitor, or you can say CDKN2A gene located on chromosome number 9p21 is the best established high risk factor for melanoma formation. Melanoma corticotropin 1 receptor gene, or you can say MC1R, is moderate risk factor for melanoma. Another gene is CDK4 gene located at 12q14. Mutation at CDK4 leads to melanoma formation. Another gene is BROF gene, frequently mutated and leads to melanoma formation. And last one is the NF1 and PTEN gene. These all 5 genes are related with melanoma formation. Environmental factors: sun exposure due to ultraviolet irradiation. Sun exposure contain mainly rays, mostly of ultraviolet rays. These rays causes melanoma formation. Another environmental factor is the fair skinned person and light thin skin type person people. These people are more prone to develop melanoma as compared to thick skin person and black population. Type of sun exposure is also involved here. For example, trunk melanoma usually developed after intermittent sun exposure, while melanoma at the region of head and neck usually developed after chronic exposure of sun. Presence of history of pre-malignant and cancerous lesion will lead to melanoma formation. Sun exposure, especially in early childhood and adulthood, have relation with melanoma. Artificial source of UV radiation, especially sunbait and therapeutic UV radiation, are related with melanoma formation. Prevention. Genetic testing according to incidence of melanoma is the number one prevention. Second is the reducing sun exposure. Third is the use of sunscreen. Classification of melanoma, or you can say historical subtypes. MC Goren in 1973 classified four types. Number first is the nodular melanoma. Second is the superficial spreading melanoma. Third is the lentigo maligna melanoma. And fourth is the acral lentiginous melanoma. All melanoma grow along the basal membrane. You know, our epidermis consisting of basal cell layer. This is the lowermost layer of the epidermis. So these melanoma usually grow along the basal cell membrane. This is called as the radical growth phase. Before penetrating into the dermis, they remain in basal cell membrane area. So we usually call it the radical phase. But when they move downward and enter into the dermis, this is called as the vertical growth phase. Nodular melanoma do not have horizontal phase and possess very poor prognosis. It means the nodular melanoma enter directly into the dermis and have very poor prognosis. Superficial spreading melanoma or SSM have most frequent intermediate situation. New primary melanoma classification. There are three main new primary melanoma classification. Number first is the epidemiological classification. Second is the classification based on tumor kinetics and aggressiveness. And third is the molecular classification. So we will discuss first one, the epidemiological classification. So based on dual pathway hypothesis, people with excessive navy and sun exposure will lead to melanoma development. Number second is the classification based on tumor kinetics and aggressiveness. Some tumors are very rapidly killer and while others are indolent. Third classification is the molecular classification. In this classification, mutation of ROS, ROF, MEK and ERK result in aberrant activation leading to melanoma formation. So up to now, it is all about the melanoma. In next slide, I will discuss its different clinical features and management. Thank you very much. Stay connected and subscribe my YouTube channel.